The UT Health Weight Loss Center here in San Antonio is a comprehensive program that includes both surgical and medical weight loss. And we are the only academic practice in South Texas for this type of program.
At the UT Health Weight Loss Center, we offer multiple services to enhance weight loss, both surgical and medical. That includes nutritional counseling, psychological counseling, as well as evaluation for each individual patient, depending on how much weight they need to lose and what kind of medical problems, if they would be better with either a medical track and attempting weight loss that way versus surgery to help with weight loss. In talking with your doctor, you'll be able to determine which is best for you as the patient.
Candidates for weight loss surgery are really defined by some criteria that were established back in 1991 by the National Institutes of Health and were updated in 2013. But that still includes people whose body mass index is 35 with medical problems to include type 2 diabetes or obstructive sleep apnea or hypertension as one of the big three, or some other comorbidities to include reflux disease, cholesterol problems. If your body mass index is actually over 40, you typically qualify for surgical treatment without any other medical problems associated. So in terms of treatment of obesity, there are both medical and surgical treatments for obesity, and individuals may be candidates for both or only one. Insurances may cover both of those. Insurances may cover one, or insurances may not have any coverage. So obesity is defined by a criteria of using the body mass index. The body mass index is a way in which we look at both your height and your weight and we come up with a number. And obesity, we know, is a disease, okay? And it's a chronic disease. Now, if we look at somebody's body mass index, the numbers will tell you that between 18 and 25, that's considered a normal weight. 25 to 30 is considered overweight. And once we get to 30, we're talking about obesity. And then obesity starts getting into having other medical problems once we start reaching numbers in the 35 to 40 range. So candidates for weight loss surgery are patients who actually hit that BMI of 40 mark. And if they have other medical problems, that body mass index can be lowered to as low as 35, with other medical problems to include type 2 diabetes, obstructive sleep apnea, and hypertension. Those are the big three. Other things that are related: cholesterol problems, reflux disease, heart disease, gallbladder problems, and those are some of the other problems related with obesity. So typically, insurance does cover weight loss surgery. It's very dependent upon the employer. Not everyone does have coverage, and so what we will do is when you come to our office or attend one of our seminars, we will actually run your benefits and verify whether you actually have a surgical benefit for weight loss surgery. Now, in some cases, you may actually have a medical benefit and you can use that. But if not, then we actually do have options for cash pay.
So if you qualify for weight loss surgery, the time it takes to actually have the procedure is somewhat variable, but there is a workup that needs to occur. Your surgeon needs to verify that you're a good candidate for surgery, and that includes some laboratory tests and seeing a nutritionist, seeing a psychologist. But in addition to that, most insurance companies require at least a 3 to 6 month time period of monitored weight loss to see if you can try and lose the weight without surgery first. That usually is the limiting factor in terms of how fast we can get to the operating room. So from the first day that you see us in the office until you are able to go have surgery, depending on the insurance company, it can be 3 to 6 months. Patients who have bariatric surgery, whether it's Roux-en-Y gastric bypass or laparoscopic sleeve gastrectomy, we want most of those patients to leave on post-op day number 1 to get home. Some patients will need an extra day in the hospital just to fully recover, and it's dependent, but we want most patients to be out of the hospital on post-op day number 1 so that they're home in their own environment, they heal up better, less risk of infection and issues like that.
So with regards to sort of excess skin after weight loss operations, that really, it's it's difficult to determine because it's really individually based. And in general, the younger a patient is, the more elasticity there is in their skin, and they'll typically find that they have an improvement in their overall sort of tightness, if you will, of the skin. An older patient may not have as much elasticity in their recovery of their skin. In either case, what we typically do is we'll refer to a plastic surgeon if you're so inclined, and we'll talk to you. They will talk to you about post-gastric bypass or post-weight loss surgery body contouring. In order to calculate your body mass index, you can actually go online and find a body mass index calculator. It's quite easy. And you'll input your height and your weight, and it will give you a number that will tell you where you are at. So the body mass index is a calculation of your height and your weight, and it gives us a number. Now, someone who is 200 pounds is very different if they're 6 foot tall or if they're 5 foot tall. So by taking that number, we actually come up with a number so I can compare those two individuals across the same way. Now, an easy way to do that is you can go to our website and you can look at our body mass index calculator that's on the website, input the two numbers, and you'll come up with what your number is.
High protein diet are meats, lean beef, chicken, fish, legumes, all have protein, nuts. The things we want to avoid are simple sugars and carbohydrates, breads, pastas. It's not that you can't have any, but you want to minimize the amount that you're taking in. So in patients who have bariatric surgery, it's believed that there is a appetite suppressant effect due to the fact that a hormone called ghrelin is produced in the fundus of the stomach. When we do a Roux-en-Y gastric bypass, we detach a small pouch of stomach from the fundus. In the sleeve gastrectomy, we actually remove the fundus. By doing that, that suppresses ghrelin in most patients, and therefore patients just don't feel as hungry as they normally would be. We think this contributes or helps with the weight loss. Bariatric surgery, we know, has a positive effect on diabetes. Some of the processes we understand why it works, some we don't understand completely. What we do know is that as patients gain weight, those fat cells contribute to the body being insulin resistant. So your body is producing enough insulin, but you're not responding to that insulin. By losing weight and having less fat cells, which is what bariatric surgery with either the Roux-en-Y gastric bypass or the sleeve gastrectomy accomplish, you reduce the amount of fat cells, and therefore your body becomes more sensitive to the insulin you already have. Many patients are able to come off, if they're on insulin shots, able to come off insulin completely, or oral medications as well. Whether or not any individual patient will come off those medications, though, is somewhat dependent upon their own metabolism.